Okay, so we're here today to talk about hip pain and performance. And our first question is, what's it like to rehab your hip with Lift Clinic? So really, this kind of gets us into, there's a whole lot of different things around your hip that can be causing pain. It's a really neat joint because it's a ball and socket, and so you have really kind of 360 degrees worth of muscles that are wrapping all around this joint and helping to control that into place. And we just do an incredible amount of movement and force transfer through this area. The first thing is, when you come in to lift, we're going to take you through an initial history. We're going to ask you all kinds of questions about, how this came on, when did it come on? Did it come on quickly or suddenly or more gradually? And once we're done asking a few questions, we're going to get into a head-to-toe movement assessment. We're going to look at kind of how everything sort of links up to produce maybe some challenges on that hip, as well as a more detailed local assessment so that we can have a bit of a sense of a diagnosis, what is specifically causing your pain. And then kind of taking those two things together. What do we need to treat more? The pain and symptoms locally, or do we need to treat the root cause of the symptoms to be able to alleviate some tension and take the stress off of those structures? And it really depends on the individual based on what's the actual injury happening for you there. So in this area here, we have lots of different structures. Starting with our hip flexors. So in the front, we're getting pain with lifting up, something like this. Groin muscles more to the inside if we're getting pain, like maybe lunging to the side or pushing off, which we see a lot, more like sports injuries coming in like that. Sometimes we see a more chronic groin pain with runners. Hip joint pain tends to be, people are saying, I feel that kind of right here. So maybe just a touch below the hip flexor. Maybe it's coming on more gradually, or in some cases we do get an acute injury like that in sports as well. But hip joint tends to be right in the front, or maybe sometimes we'll feel that kind of bracketing around the hip a little. IT band is pain referral that we're usually getting kind of coming down the side here, and it may be coming from some really tight muscles in the glutes on the side. And so there may be a trigger point there that's actually just so much tension that it's causing pain referral down the leg. When that gets really sore, that'll come even further down into this area. Sometimes people will feel it even when they're at rest. Posterior glute, same thing. If we're just moving a little bit further back, can often have a pain referral that sometimes crosses the low back, and then also can come down into the area around the hamstring and even down as far into the upper calf. And so sometimes people will call this like sciatica. The root cause of it might be at the hip joint or might actually be at the low back. So we need to kind of figure those things out. SI joint is another area that people will sometimes associate with the hip, and we're just kind of right there where the pelvis joins the sacrum, and that can be inflamed and sore itself. And then hip abductors, again, just sometimes we'll get that more local muscular pain in the side of the hip there. So why seek treatment sooner rather than later? Really, it's just because this is a complex area where there are many different reasons why you could be getting your pain. We want to assess what the root cause of your pain is, and also understand if we can get to that specific diagnosis of what's causing the symptoms locally. As soon as we can do that, now we can kind of get you faster onto a track to take the pain down and doing the right things to address the root cause as well. So the next question is, how do our different disciplines treat hip pain? So here at Lift, we have physio, chiropractic, massage therapy, strength and conditioning, and everybody can actually make a contribution to this. Physio, chiro are gonna often be associated with, like, our bread and butter is really detailed assessments. So often people are coming, when they're in pain, they're gonna come to physio or chiro first so that we can get that really detailed assessment. Sometimes people are gonna go, if they have that sense of like tension, and it's just sort of a tight muscle, and they're gonna go into massage therapy first, because you have that intuition that's like, I just need to get this thing loosened up. And that's okay as well. Sometimes people also do go directly into our strength and conditioning side of things. And it's important to understand that the strength coaches who work here, are trained in rehabilitation as well. And so they're trained a lot to assess and deal with people and deal with people on a day-to-day basis that are going through pain or managing pain or being able to kind of like push themselves to the peak of their performance, in which case sometimes you do get a little soreness and some pain and stuff like that. So they're super comfortable with that. How do we treat the pain differently? Just depends a bit on the individual as well as the scope. And so what's important is for us as a team to have an understanding of how each of us can contribute to best helping the client. And that's something that we spend time on every single week, getting together, working as a team, training together, and so that we can kind of coordinate that experience for our clients. Okay, so our next question is, how does optimal hip function help you to run, jump, train, and play? And so, this is an area where we have an incredible amount of power and force transfer. This is an area where we see a lot of people who have like fundamental strength and mobility problems that are really limiting what we can do in the gym or on the field. Things like, say, coming down a hike, and you're gonna notice that your knee maybe collapses in a little bit when you step down from a big step, or coming down from a big jump and you see your knees kind of coming in a little bit, or just feeling a little bit slowed sometimes and having a change of direction and being able to move like really, really powerfully. In the gym, we'll see it with things like our squats or lunge movements, where we're starting to get heavier and we're noticing that those knees want to come in a little bit, something like that. So running, really good hip performance is pretty important there as well, because we're just trying to actually take that hip through a lot of range of motion. When we're sprinting, it's going through nearly full range of motion at an extremely high rate of speed. When we're doing distance running, this is just, again, that big powerhouse that's kind of connecting your core and trunk to your legs. And so much power needs to be going through that hip. And then so for lift, to help you achieve optimal hip function, this is a really interesting one that can often benefit from collaboration between disciplines, physio, chiro, and strength. So having a really detailed assessment, getting that specific strength assessment for your hip, and then being able to see if there's any sort of a relationship that's kind of undermining your strength. We just see that it's so common where people will say, come in, we'll do a strength test for hip abduction in like a side-lying kind of clamshell position. And we'll often see something like maybe anywhere between 10 and 25 pounds of force being produced in like an adult. And we're looking more for something in the range of 50, even up as high as 80. And so when we're seeing this, we're like, okay, this is that person who's gonna have the knee collapsing in or gonna be having some performance challenges. Now we need to figure out why that's happening. In most cases, not just because we have a weak muscle that needs to be trained, but because there's some aspect of mobility in the system, so in the low back or in the pelvis, in the trunk, that is actually not allowing the person to get easily into a position and kind of get that activation. So it's sort of like all the muscles are there waiting for you, but they're just not getting the signal.